You're listening to The Q Switch with your host, Spence.
Welcome, one and all, to the Q Switch Conversations podcast. I'm your host, Spence, and the mission of this show is to tackle subjects currently impacting ophthalmology and pull in leading eye care professionals and industry players to discuss their unique perspectives. So let's get into it. Today, we're tackling a subject that so many ophthalmologists think about, but few talk about openly. And that's transitioning from the world of private equity-backed practices to the independence of private practice. And I couldn't think of a better person to guide us through this journey than today's guest, Dr. Shruti Aggarwal. Dr. Aggarwal is a fellowship-trained cornea specialist, a proud graduate of the distinguished Bascom Palmer Eye Institute, and now the co-owner of Horizon Eye Physicians and Baltimore Washington Eye Center in Baltimore, Maryland. After spending 4 years in a large, established, private equity-backed practice, she and her colleague Pranav Patel decided to take that leap and start their own practice. And at the same time, they took on the major responsibility of acquiring a long-standing solo practice, the Baltimore Washington Eye Center, as I mentioned before, which was founded in 1980. That means that they're not just building a new practice from scratch, they're also modernizing, renovating, and transitioning an older practice into today's competitive ophthalmology environment. It's the perfect case study for our topic today, transitioning from private equity to private practice in 2025. Dr. Aggarwal, welcome to the show.
Thank you so much, Spence. Thanks for having me. I'm very honored to be here with you.
Well, good. Let's start at the beginning. Many young ophthalmologists consider private equity-backed practices the quote-unquote safe route after training. What was it about that environment that initially drew you in, and what ultimately made you decide it was time to strike out on your own?
Yeah, so I just finished fellowship from Miami and I was moving to Baltimore. My husband had a job here, and this was a great practice. It was a big established private practice that had been around for a long time, many locations, private equity backed, and it was a great first job. I had, established practice. I walked in with an established patient base and didn't have to worry about any other skills than to being able to hone my clinical and surgical skills. But over time, I didn't feel like this was something that I saw myself doing for the next 35, 40 years of my life. I was looking for more autonomy, more flexibility, and to be able to deliver the care that I wanted in a personalized fashion. I had a certain vision of how I wanted to treat patients and be a resource to the local community. And I was fortunate to meet my friend Pranav Patel, who was at the same practice. And I felt over time that we had the same vision for patient care. We had same goals and same ethics, and it was just exciting. And as a background, my dad had actually started his own practice when he was mid-30s back in India. He started with a one bed in a dialysis center in the backyard of our house, actually, because at that time there were no private places for dialysis in India. It was very resource limited industry at the time. And I saw him build a practice where he went from that one bed in our backyard to a multi-subspecialty nursing home now, where he has provided wonderful care to the community. He's been a huge resource. He's basically just worked really hard and built something. And I saw the pride that he had in what he had built. So in the back of my mind, that was something that did sort of drive me. And when this opportunity came along, we were thinking about it. I felt like this was something that might be very fulfilling. And so far, we're 2.5, almost 3 years in it. We started from scratch. That was our first practice, Horizon Eye Physicians. Then we had the fortune and serendipity, luck, whatever you might call it, of acquiring the second practice this year. And so far, it's been a fantastic, most rewarding thing that I've done in my career. I felt like I've grown. And as an individual, I've learned skills that I did not know necessarily anything about: developing a business, leadership, leading a big group. We started with just the two of us, one technician, one front desk, and we've grown to now 45 people.
Wow.
So it's been great.
And we're going to dig into that as well as we move on here. So that's such a big decision. And what makes your story even more unique is that you weren't just starting from scratch. As you mentioned, you were also acquiring an older, established practice at the same time. How did you balance these two very different challenges and building one practice while modernizing another?
So let me actually correct you a little bit there.
Okay.
We started from scratch in 2023. And that what we started and we built from scratch there. At the same time, we started going to this other practice just as employees at that time because this
Ah,
older
okay.
wanted to retire and he needed help. He had, a big patient base and he was looking for other doctors. So we started going there once a week, each of us, and operating there just as employees. So it gave us a chance to kind of get to know the staff and the patients and the lay of the land. And then it just ended up being a good fit. That Dr. Betancourt, who had been at the practice for 35 years, decided to
Hmm.
retire. And then we ended up acquiring the practice. So it was a little bit staged in that sense. First, we started our practice, the one we started from scratch. And that was, just thinking about the whole practice in terms of what our vision was. We established everything, all the operations were as we wanted it. And the
Hmm.
struggles are a bit different when you are starting from scratch versus when you're acquiring. And I think those are sort of for anybody who's looking to start private practice, those are the two options, right? You either, or I guess there are three options. You either first start from scratch and do everything the way you would like to, but that has its own unique challenges that we can talk about in a minute. The second
Hmm.
option is you buy, and if somebody's retiring, you buy their practice. That's the second option. And the third is you start as employees and you are on the partnership track, you buy into the practice and slowly get vested into the practice. And I
Hmm.
think by our journey, it's kind of been a combination of all three of sorts. We started from scratch, one location. The second, we started as employees. Instead of traditionally buying into the practice, we just bought the practice outright when he retired. So when you think about starting a practice, I think it has its own challenges because you don't have anything established. It's a blank slate, which is very exciting. Everything is very exciting. Trying to find a good location where you think you might thrive, trying to figure out how you want the office to look. I, was very passionate about what the floor plan should be, what the colors of the walls should be, what kind of art should go on the walls, those kind of things. But also having good operations in terms of what EMR you want, what PM system you want, how you're going to market, what kind of referring providers you're going to market to, but also the basics of cash flow, how you're going to start the funding. When you start, there is no cash flow because you don't have an established practice. So those are all the challenges that you have to think about, but it's also very exciting because it's your own. You're taking something and you're putting down whatever you want or however you vision it. In terms of acquiring a practice, I think you are kind of bound between the realms of what that existing practice is, what the location of where it is, the people and the staff and the patients. And that truly is actually the biggest asset of the practice. Having
Hmm.
loyal staff, having established patient base is the biggest driver of acquiring a practice. And having done something from scratch where you're waiting for like patients to come through the door versus having some place where you have built-in cash flow is a huge advantage. Having said that, it is also a challenge to be able to modernize the practice because if this was an old practice, we had to change a lot of things. There is an established culture, which was very good, but at the same time, you want to make it a little bit more personal. So you have to strategize on how you're going to bring in your vision with the existing culture of the practice. And that transition can be challenging, but it can be extremely exciting. And, I have been very, very fortunate to have extremely resilient and loyal staff, very, very good patients. And I will probably say we've kept almost all the staff that was existing with the practice. Everybody stayed on, a couple people retired. But we've been extremely lucky to have people who know what they've been doing, who believe in the mission of the practice, who were excited to have new leadership and kind of stay on. So it's been fantastic.
So what I hear you saying is that you're balancing those two tracks must have required a lot of careful planning, especially when it came to the money aspect, which you touched on. And so what were some of the biggest financial hurdles you faced early on, and how did you navigate them?
Yeah. So I think when you think about funding or financial challenges, I think it is a true startup in one way, right? When you're starting your own practice is no different from starting a technology startup or whatever. So you have to plan for it. I think we did have about 6 months lead time to know when we were going to start. So we were thinking about using our personal finances. But I think in our case, there is different ways to do it. You can use your own money versus you can apply for funds. When you apply for loans, there are different paths. There are traditional loans that you can get. There are SBA loans that you can get. Each have their own like positives and negatives. We went with a traditional loan. I think the most important thing of getting a loan was that both of us were not new to practice. We were practicing. I had been in practice for about 2.5, 3 years. My partner had been in practice for about 6, 7 years. So we had a track record. I think the most important thing for anybody who's looking to do this to have a very solid business plan. I think the more you can sort of define in terms of what you're looking for, what your fixed assets would cost, what your recurring costs would be, what you're anticipating the build out to be, how much equipment you want. So having a good solid business plan where you can itemize every single expense in terms of recurring costs or fixed costs and be able to project what your income might be based on. And for us, it was easier to do because we did have some form of a track record that we could use. So I think having a very solid business plan is the first step of trying to acquire funding. And then I think there is also who you go to for funding. You can go to big established banks or you can go to more local, smaller banks. In our case, we did try to shop around a little bit. We ultimately settled with a local bank that, worked a lot with small businesses in Maryland and that worked out a lot for us.
So, and of course, in ophthalmology, finances aren't just about rent and payroll. Equipment and operational costs can be enormous. How do you balance the need to invest in new technology with the reality of keeping your business sustainable?
Right. So that's a great question, Spence. I think there is a lot of thought that needs to go into how you're going to structure your equipment versus where you're going to spend your money, right? You have a limited amount of fund that you have to figure out what and how you're going to use. So I think when we started our practice, we had built a practice over. Our first office is about 4,500 square feet. So we built out 7 exam lanes, imagining that we would grow over time. All the advice that I'd gotten from other people was that it's very difficult to change physical locations or add space as you grow. So we built out the 7 lanes when we were building the clinic, but it did not make sense for us at that time to equip all the 7 lanes. We started off with just 2 exam lanes that we fully furnished, and one of them was our tech lane. The other one was actually an ADA compliant lane with the sort of the setup where the wheelchair could slide in and out also. So that way, even though we just had 2 lanes, it was enough to start with. And now slowly we've built out and we have now 5 functioning lanes in that office. But in the beginning, in terms of trying to figure out what we needed, we sort of strategized as to what we needed to be functional, but at the same time, not buying equipment that we weren't necessarily using. But as you said, as an anterior segment practice and as a refractive surgery practice, you want to have a good topographer, you want to have a good biometer. So we did want to invest in good equipment that was reliable, that gave us the best outcomes, because ultimately when you assess any kind of equipment, you want to be able to have things that give you the best patient outcomes also. Plus being easy to use, you have to be mindful of the staff, things that people can be trained on. And technology, like this is all the stuff we have these days, should be able to talk to your EMR, should be able to be transferred. You should be able to send your notes easily to other providers because we work on such a shared platform these days with other doctors. Patients are very aware. They want things to show up on their devices. They want their records. So all the technology that we bought, we wanted it to be modern. We didn't want to be stuck with things that we had to change every few years. I think, first of all, as a small business owner, as a startup business, I think it is important to learn every single role yourself, like to be able to schedule patients, to do the billing, to understand what the EOBs look like, to be able to send letters to the referring providers. I think it is important to know what needs to be done and how many people you need and to cross-train people, because hiring good staff, training them, and keeping them is a challenge, unfortunately. And these days, the reality is the reimbursements are going down. All of healthcare is moving towards consolidation. So independent private practice doctors are essentially a dying breed right now. All the private practices are essentially consolidating. And that is very concerning because if you look at all the research and the data, it shows that consolidation actually drives up healthcare costs instead of bringing them down.
So once you had the right people in place, the next challenge was making sure they were fully prepared to grow with the practice. You mentioned earlier that, in Horizon Eye Physicians, you have 7 lanes ready. 2 are fully equipped now, or in the beginning, and now you're up to 5. So much like with your equipment and technology, I think that the same applies to your people. How do you prepare those folks for growth as the practice grows and volumes increase, and things still need to be efficient as the patient pace continues to grow and you have more traffic at the practice?
So that's a great question. I think what makes a medical practice is the staff. We are in a people business. We are a patient-facing business. When people come, they're interacting with our staff, they're interacting with the doctors, and the least we can do it is make it a good, welcome environment where people feel valued. And that goes both ways for patients and for staff. I think the most important thing to develop your staff is to be able to have a clear vision and to have a clear communication strategy. In terms of like front desk, for example, just trying to communicate how to talk to patients, how to be efficient, to be able to answer all the phone calls and be able to make sure patients get what they need. And then when you think about growth, honestly, I think if you have good operations in place, it is not difficult to scale up. But the core is having good technology, good staff, good understanding, and good communication amongst each other. What we have done, we have a front desk manager, we have a call center manager who work together, who take the phone calls and work with the employees at the front desk. Our lead technician leads sort of the technician teams. And she leads the scribes. We have an optical manager who leads the opticians and the optical space. We have an ASC manager who leads the ASC. And it is important for the manager to know how to communicate with the team and to be able to anticipate if somebody's going to be out, who's going to be plan B that day, who's plan C that day, and to have all the operations written out in case somebody's out. They know what to reference, how to kind of build. And I genuinely believe it is not difficult to grow if you have good practices to begin with. Then you're just scaling up the same operations that you have.
Mm-hmm, mm-hmm. So training and operations, and kind of you talked about communication and organization and really having all these pieces of your practice, from the front desk to the ASC to the call center. All these moving parts have to work well as a well-oiled machine, with you kind of really pulling the strings or guiding and keeping things running smoothly. And that's all well and good, but that's only one piece of it.
It's not always smooth. We try to make it smooth. We want it to run. But there are days when things fall apart, when,
of course,
things are not going well. And, then you debrief and see what's going on and, try to get everybody in the room and figure out why something broke down or what can be done better.
Mm-hmm. And I think those are opportunities. Again, nothing ever goes as planned as far as I can tell.
Yes.
But when those opportunities come up where things don't go right, I think that the best practices that I've seen succeed do like an assessment, like, hey, what went wrong there? Let's go and, course correct so that if that should happen again and it's inevitable, that we handle it differently and do better. And it sounds like you have that type of a culture where you want to self-assess and improve, not just for you as a leader, but also all the different areas of your practice, and it goes all the way down to the individual.
Right. I think we are very lucky. And the staff that we when we expanded and bought the second practice, a lot of the staff had been there. There have been people who've been there 20 years even, and I've been doing this a long time. And I'm very grateful, because a lot of times in medicine or running a business, it is experience, right? There are many things that I may not be able to anticipate or know, but I am lucky to have staff that might be able to say, this is what we should be doing, or this is how we've done it. This is what has worked in the past. This is what has not worked in the past. So listening to people and their ideas and trying to formulate those, along with, I think trying to use modern technology. I think we're at this time where there are many things that can be automated also, and better chances for communication with just email or internal communication systems and things like that can also help. So I think that all helps. But at the end of it, you have to be able to be adaptable and be able to think on your feet, because every day things will come up that you don't anticipate. And
that's a great point, because as you update technology, bring in new personnel, there can be introduced into the environment new rules, red tape, things that that you may not have accounted for. What may have caught you most off guard in terms of compliance, insurance, regulatory challenge that you're like, I had no idea, and we got to deal with this?
To be honest with you, Spence, when we took over the practice, just the ASC part, like we had to do like a change of ownership. As a CON state, because we were doing a change of ownership, we had to do paperwork for that. I was very involved because I wanted to learn everything about it. So I actually decided to do the paperwork myself.
Wow, that's interesting. Oftentimes you would think that, at least I would think that, as a surgeon, you've been training all these years as a surgeon, as a care provider, as a clinician, to want to be able to take on like the administrative understanding and inner workings of how those contracts work, and that's very ambitious, and I would consider that unique. Why would you want to put yourself through that?
In any way, I'm learning a lot, but I wanted to know what the process entailed, so I knew what the I was so amazed by the things that we need, like the HVACs, the number of HVACs you need in a surgical space. Ours is like a one room, one procedure room ASC, but the femto room has to have its own HVAC. The laser room has to have its own thing. Like, I feel like the manuals I read about the HVAC systems and the filter sizes and all of that, all those things, you're not prepared for any of that. It's fun to learn all that. It's great to have staff who also understands all of that. We went through major transition when we took over. The second space is a big facility. It's about 10, 11,000 square feet. We renovated, gutted the whole space. That was a huge challenge. We
Wait, you gutted the whole thing?
The whole waiting room space.
Oh, wow.
You visited, it was brand new.
Okay, that's the one I saw when I visited you. That whole area when you first walk into the, I guess, is it both the right and left where the optical's at, as well as all the patient waiting area? All that's new.
All of that is new.
Oh, wow. They did a gorgeous job, first of all.
Thank you so much. We brought down all the walls and everything. And then all the exam lanes, we moved from carpet to hardboard and paint everything out and change the lights, LED lights and everything. So it was required a lot of planning because we were still seeing patients all the time. We only closed for 2 weeks for the 5 months that we were in renovation. So that required a lot of planning in terms of being able to figure out how we would see the patients. We were lucky that we had 2 locations, so we were able to kind of move things around. But it was very challenging in terms of being able to see patients while being in renovation. You have to think about safety. People shouldn't be tripping, give them a heads up, things like that. But that transition was challenging. And then the biggest challenge, I think, was we updated our PM and EMR system, being able to, with all the technology change, we updated. So I think we made a lot of changes at the same time. We updated our phone systems, our computer systems, our PM, EMR. So there was a lot of transition. And part of it was, should we do this in phases? Should we do it all together? We ended up doing everything together. So first 6-7 months were very challenging in terms of getting everything to settle, but I think it's been well worth it.
So I got to ask, because when you have that much change going on in a practice like Baltimore Washington Eye Center that's been around since 1980, those patients are conditioned. You said employees were there for 20 years now. They're conditioned to have things a certain way. Yes. Where that wall was, it's gone. Where that chair was, it's moved. Yes. So and change isn't welcome for everybody. And especially patients who, who come to your practice, they're older folks. They're used to having, a certain thing a certain way and not seeing their primary provider. How did you prepare your patients and some of the staff who may have been around a while for some of these changes and transitioning from Dr. Betancourt to you and Dr. Patel?
Right. So I think one of the biggest sort of blessings was that we had already been at the practice for 2 years, where we were, going once a week and operating there. So I had gotten to know the staff really well. We had gotten to meet a lot of the patients also, because we had taken over quite a lot of the patients over the past 2 years. And Dr. Betancourt is an amazing person. He was extremely gracious. He actually made an extra effort of introducing patients and telling them that the practice was going to go through transition and there would be new coming in. So I think all of that we did plan for transition. Nothing can prepare you for the change when it comes. I think it is rough, especially with everything happening at the same time. But I will say people have been extremely gracious. Majority patients have been very sweet and very appreciative. They come now. We've had many people come, walk out of the doors, turn back, go into the elevator, go down, check again, come back up because everything looks so different.
That's funny.
They enjoy it. They've been coming here for 20, 30 years. They like to see the change. And some people are grumpy. They don't like the color of the walls. They miss their old setup, which I also understand. I know it's hard. Like, you've been used to seeing a particular doctor. You see them every year, twice a year for the past 30 years, and now you have somebody new. It's difficult, but I will say for majority of it, everybody's been very gracious and has put up with the change really well. And I think part of it was just communicating with everyone ahead of time, trying to tell them, hey, right now we're going to change the exam rooms. Most of this will happen on the weekends, but Monday morning, be prepared to come to a dusty room, and I will say our staff has gone above and beyond. I'm extremely grateful to all of them. They would come in a little bit early on Monday, clean up the rooms, make them presentable, make sure that it was safe for the patients. So as a team, I think we all were able to pull it together. And we're still going through a lot of changes, a lot of transition, but it's coming together, and it's been a very fulfilling experience.
Yeah, well, I'd probably agree and probably, build on that in that, like, especially with the people in the demographic that walk through your doors, older folks and not really accustomed to change, um, that you had mentioned like advanced notice. You started to plant the seed early, you and Dr. Betancourt and Dr. Patel saying, look, this is going to happen 6 months ahead of time so they can start to mentally prepare for, you know what, I'm going to walk in here in 7 months and Dr. Betancourt is not going to be here. So that, friendly conversation, a cup of coffee I may have and the time he spends with me, that's not going to happen. So that they're not like shell shocked when they come in and, it's here one day, gone the next. I think that's probably, with, again, the mindset and mentality and emotionally what these patients feel and go through with these kind of transitions. And it sounds like you and Dr. Patel, as well as Dr. Betancourt on the front end, have really handled this with grace, and the transition has been successful.
And we also have a wonderful optometrist, Dr. Shari Stryer, who's been with the practice for 27 years. And she
Okay, all
has
right.
fantastic. She is another pillar of the practice. She understands the practice really well. She has been indispensable in terms of the transition also. Very, very important part of the team as well. And because she has stayed on, so she has helped a lot with the transition. She has been with this team for a long time. So we're very grateful to have her. Since Dr. Betancourt retired, we brought on another optometrist, Dr. Eaton. So I think we have a great team of people and everybody shares the vision of providing good care. I think that's the most important thing. Ultimately, I think our staff, our employees, our other doctors, everybody's shared mission is to do a good job, have patients feel cared for. And I think that's what works at the end of the day.
Of course, in Baltimore, it's not just about internal challenges. You're also competing in a crowded marketplace. How do you position Horizon Eye Physicians and Baltimore Washington Eye Center to stand out against larger corporate groups and hospital systems?
No, honestly, Spence, I think healthcare in general is just providing good care that you would want your family to receive. Like when I started this practice, Dr. Patel, I think we have a shared vision of having a culture where patients feel valued, where we feel like they get personalized, customized care. And at the same time, the staff feels valued. I think a lot of problems with the corporate culture is people don't feel valued. I think that's the biggest problem. And that has nothing to do with, I think, the employees or the doctors or anything. It's just the model, right? Venture capitalist or private equity, they are meant to make another sale in 3 to 5 years. So they are not looking at longevity. They don't care about who stays or who leaves as long as they can get profit and sell it again. And I think that's the crux of why having your own practice that is your brand is important, because what happens in our practice is directly reflective on us. This is not somebody else that we can blame. If something goes wrong, it is on me. The brand we have. So it is very important to have a clear vision. I think we are very sure we want to provide a modern, customized, personalized care where people feel valued, not just the patients, the staff as well. Everybody feels like they're being looked after. And that is what we want to provide. And that is what we strive to achieve. And I think that is what speaks to patients. We get patients still by word of mouth. We have people that will bring their neighbors, that will bring their friends. And, I think ultimately, marketing obviously is important, social media and all of that. But I think most important, the biggest referral is the patient who can bring other people in because they had a good experience. And, we have been, initially when we started, I think we have done a lot of door-to-door marketing, trying to go meet with the primary care doctors, trying to meet with the optometrists, trying to sort of put a face to the name instead of just being, there. I think it's important to reach out to people in a personal, one-to-one manner.
Sure. So, and being competitive also requires strong leadership from the top. That means you and Dr. Patel. What have you learned about balancing your role as both a practicing surgeon and a business leader? Because those are two completely different things. And again, being the co-owner of a practice, you have to wear both hats. How's that been for you?
So I think it has been a great experience. I will be honest. I don't know what I was getting into because I didn't have much of business experience or anything. But I think as long as you are intentional about how things are done, I think if you break down small challenges into, this is what we're going to work on right now. We want our EMR system to function in a certain way. We want our call center to function in a certain way. If you break down little problems, and I think it's actually easier. I will say it is good to have experience on the ground when you are building processes. I think it's actually almost harder if you're just a business owner and you've never been a patient or a provider yourself, it's actually harder to know what you would value. Because I am in the clinic myself, I know what kind of technology I want, what's easy or what makes my day efficient. If, having 2 screens up to review imaging in one room and having the surgical coordinator present on site because the patients can go meet them at that time, these are things only I can anticipate, or people who are providing care directly can anticipate as to what makes their clinic run better versus somebody who only has a business background. They may not know what the ground reality is, what actually makes a patient experience. So I think it's actually easy. It gets easier over time because you know what the challenges are. And then being a business owner, you actually have the ability to fix those challenges. I think that's where employed physicians have a harder challenge because they know what the problem is, but they can't actually make the change themselves. And I think that's where it's easy if I know where the problem is. I'll give you an example. So we have scribes in our practice, and I love working with scribes. We have these kids who are extremely motivated. They want to get into medical school, PA school, nursing school. They're extremely bright. They will never complain. They're always happy, and they're very, very motivated. I love having scribes. I feel like it has increased. I can see double the amount of patients that I used to when I was doing the charting myself. I have 2 scribes in my clinic. I see about 60, 65 patients a day, and one room gets loaded with 1 scribe. I directly talk to the patients. I don't have to look at the computer at that time while I'm talking to them. Patients feel like they get a really good experience because I'm talking to them, and my 100% attention is at the patient. I'm able to talk to them. And the scribe in the meantime will take down all the notes, will go over everything afterwards. The prescriptions will be sent in. So there's less burnout on my side because I feel like I'm functioning basically on patient care. And that, to me, that a business owner might look at this and say, oh, you don't need a scribe. You can just do this by AI or do this yourself. This is an extra cost. We're going to get rid of these 4 employees. To me, because I am there, I know what makes my practice efficient. It helps me to make business-related decisions while being the surgeon or while being the doctor, because I know what helps me, what helps my patients. Sometimes we have this person who helps with the prior authorization, and sometimes people have a hard time. They can't just log into a app like, all these specialty pharmacies, Philorex, Blinrex, that we do dry eye medications and stuff with. Some of our patients don't know how to respond to text messages on their phone. They can't really sign up for anything. They just don't have that know-how technologically. We have, I have this person who I will say, well, if a patient is complaining, I want you to be able to sit down and help them, walk them through this. And those are things that I can anticipate, and I am in the position to make those changes, but because I'm the owner as well. But if I was an employee, I might say, I want somebody to do this job, and that may not happen. So I think it's definitely challenging to find the time. I think the other thing is being able to carve out time. So I do try to be very intentional about having set admin time where we will have like meetings where we'll say, these are the things we're going to discuss. We have standing meeting with myself, Dr. Patel, and our practice administrator once a week. We have some scheduled meetings that we do with, the different managers of the different departments. So I think it's also being intentional. Having said that, it doesn't go like that. You go in, there's a different challenge every single day. There is some problem that you cannot anticipate. I'm like, okay, let me finish surgery. I'll come talk to you about this at 2:00 or something, So,
well, I will tell you that going back to earlier before I forget, what I love about that example with the scribe is that again, I think it supports and speaks to your vision and your focus on feeling valued. I can't tell you how many times I've gone to, whether it's a pediatrician with my daughter, or going to the doctor myself, and the doctor is typing, speaking, and so 50% of the time I'm charting notes. The other 50% of me, he's talking to me. It's more just like just asking me questions. But when you, in your situation, where you have a scribe, you can give 100% attention to that patient. And even though it may seem like a small thing, I can tell you as a patient, I notice that when I have that interaction and it's just that next level care and attention that makes you feel valued, like this guy's really paying attention to me, or this woman's really paying attention to me, and they're really going to diagnose what's going on with me, or simply just give me an exam that's complete and comprehensive and thorough, and not just focusing on making sure that they spell these words right. So I would say that, even though it may be a small thing, I'm glad that you share that example because I think it's super powerful.
Also, I will also say, it's important. What we're building is truly a service for the community, right? I also love having people to mentor, like these scribes that I have. These are brilliant people. I want them to,
All right.
I'm always sad when they match into like, medical school. I've had a scribe who went on to medical school recently
Is that
too.
right?
One just started med school this summer, one started PA school, two went into nursing school. I'm very proud of them. I'm very sad to see them go, but I want them to, get better, ultimately do what they're meant to be doing. So it's also just being able to develop your employees and giving them the tools and means to do other things that they would like to do. And that also I feel like as a leader or as a business owner, that gives you some unique sort of power to be able to do as well. I think we pay attention. And that's the other thing with transition. I think we did have some people had a hard time with certain aspects. There are some people who had a hard time when we moved, say, from paper fax to e-fax.
Sure.
That was a big thing in their practice. Some people were used to just grabbing papers off the machine, scanning everything in, and then faxing them over, and then shredding everything. So we're like, okay, we're not going to do this anymore. We're just going to have e-fax. Literally, one of the employees was like, "What do you mean by e-fax? Fax by email? What does that even mean?" And it was adorable. I think it's sweet. I said, well, this is what we're going to try and do because it'll make your job easier, trust me. But ultimately, some people can't adapt to a particular job. Then you try to find something else that they might be great at. Like, okay, if this is difficult for you from now on, try maybe just doing the phones for now and see if that's easier. So I think sometimes you have to adapt. You have to figure out everybody has some great strength, right? And you're trying to figure out who's good at what is another thing to be able to see. And, we learn every day from our staff, from patients. A lot of patients will come say, oh, and I didn't pick up on this. We ended up, the waiting room that we redid, you saw it was modern. We changed all the lighting to LED lights to make it brighter. So it got like, nice, modern and everything. And then I had a patient who's like, oh, he's like, it's too bright. I'm dilated and I'm having such a hard time. And I was like, I didn't even think about this. So then now we boarded off one section where we've turn out the lights, make it easier for patients. But it's just something
nice.
that didn't even think about. Like, it's so obvious. Like you would think that this is 101. People are dilated. You don't want a very bright waiting room. But that was just something that we thought about later on and then fixed it. But so many things that you don't think about.
Well, I think that, as this is growing and developing, again, there's things that come at you that you don't see coming, and you have to adapt and pivot and make changes on the fly. Just by speaking to a patient, you just mentioned that example now where the patient preferred a different set of lighting while they're being dilated, and you're able to accommodate that patient, again, feeling valued. You didn't like, yeah, sorry, lights are the lights. You were able to say, you know what? I understand Mrs. Jones, let's go and take care of that. So the next time she comes in and she's dilated, she will know, trust me, that patient will know that, like, well, I'm actually in a dim area. Well, I wonder if that was because of me. And she's like, they responded to my request. I'm telling you, that is super powerful. And I think one of the advantages of, like you said, being a business owner and being able to call the shots and make changes, because there's some larger environments, large hospital systems, and larger organizations where the smallest decision, it has to, and trust me, I've been in corporate America for quite some time, making small changes, it can be a marathon event where all these different people have to sign off. So with you as the business owner in a small environment that you kind of really, control, if you will, you can say, you know what, that patient's right. Let's do something about that. Next time she comes in 6 months, it's changed, it's done. So the efficiency and ability to pivot and be nimble, I think, is also a strong advantage. So let me just carry on here. So that with that perspective, I'd like to maybe zoom out just a little bit and take a look ahead. What trends do you see shaping the future of independent ophthalmologists over the next, say, 5 years?
So there are, that's an interesting question you bring up. Nobody knows what's going to happen in the next 5 years. I feel like policies and healthcare is changing so rapidly right now. Even in the past, couple years, things have changed so much. I think it's very concerning in terms of declining reimbursements for patients, declining reimbursements for doctors, practice costs going up. It is very difficult to build a sustainable practice, to be able to employ good talent, to be able to keep them, and to be able to provide good care. It is difficult, and all the practices, especially small practices like ours, have to be on our toes at all times to figure out how to create more value. Does that mean seeing more patients? Does that mean doing more premium technology? Does that mean automating certain things where we can cut down on the number of manual things that we have to do? So all those things we have to think about. I think in 5 years, in terms of how things are done, I think AI will have a huge role in things like insurance prior authorizations and the RCM processes, even scheduling. Maybe there may be some role of AI in terms of answering phone calls. I don't know. I would think that AI would take over everything in terms
Sure.
of things
Yeah, sure.
that can be automated. I don't think AI can do our surgical jobs as
Right.
of now. I think my job is safe for the next 5 years in terms of
Knock on
surgery.
wood.
Yeah, I hope so. But, I think we are seeing a lot of changes in terms of AI. I think practically we are seeing a lot of changes in terms of planning, just financially, a sustainable practice in terms of being able to keep the staff and being able to, provide the same amount of care we do, because it is a true challenge. I mean, private practices are dying for this reason. I know a lot of retina practices are having a hard time sustaining because of the cost of the drugs and everything. So there is a reason that's driving this consolidation. I will tell you, all the doctors that I've spoken to who have consolidated or sold, none of them are happy about it, but it becomes almost like an exit strategy because it's starting to become unsustainable. So I do think from an advocacy standpoint, it is important for us to advocate for our patients, for our staff, for the community, because I do think the sad reality is that people will start walking away from private practices, and that will actually, on the hindsight, drive up healthcare costs and provide poorer care. I know personally a couple people who are contemplating stopping to do surgery in the next few years based on the reimbursements. There are a lot of doctors who don't have premium technology or cash-based things to offset the declining reimbursements. And I
Sure.
will tell you that I'm a part of this online physician ophthalmology community, and there are people whose sad reality is that they're having to think about stopping to operate over the next few years because it's not sustainable anymore. As you know, the truth is our equipment is expensive, our staff, the number of people we need, and everything. It is a challenge, and we all have to learn how to pivot and be able to take care of these patients. And I can't tell you how that's going to be sustainable, but we all have to find ways to keep doing what we love doing and provide the care that we need to.
Well, I would say, and it's my feeling that the most successful independent private practices are going to do the kind of things that you're doing, really putting the people first, really driving home the point about valuing your patients and putting practices, systems, and processes in place that can communicate that in every way possible as that patient takes that journey through your practice. And just as valuable as you want to make the patients feel, also your employees, probably even almost more importantly than the patients, because they're the ones who provide that service and care, that you've set the standard for, and also carry out your vision on a day-to-day from the person who picks up the phone to make a schedule an appointment to the person who walks up, to the front desk. And again, through all the different areas of your practice. And so if you can manage to harness the power of building value and establishing a culture and environment that people want to be at and patients want to visit and get care from, I think you're going to be one of the folks who can overcome whatever challenges may be in the next 5 or so years. And I think that you and Dr. Patel have certainly got the right recipe. So for those who are listening and maybe thinking about taking the same leap you did, what's the single best piece of advice you'd give an ophthalmologist considering leaving a private equity-backed group to start their own practice as you have?
So I think the single best advice I can give it is, if you're thinking about it, just do it. You're going to have a great time. I can write it down. There is no lack of patients there. Everybody needs good care. If you have a vision, you can execute on it, no problem. Just believe in it, and there is a lot of resources out there. I personally have benefited from a lot of colleagues around me who've been gracious with their advice, with their help, with their mentorship, and it's definitely doable. It is extremely rewarding. I have been doing this for 2.5 years now and have grown very quickly, and have been able to build a team that I'm proud of. And I truly look forward to going to work every single day. And even if I have to go in on days when I'm not scheduled to go in, I, so far, over the past 2.5 years, have never not wanted to go into work.
Well, I know that, I've known you for quite some time, since your, residency at Bascom Palmer, and you are the most joyous, happy person. You love what you do. And they often say that if you love what you do, you don't work a day in your life. And I think that you can certainly embody that, and you show that every day. And at least when I've seen you and met you and worked with you, and I'm sure that your team and your employees and Dr. Patel, your partner, see that as well. And so last question, looking back on your own journey, if you could do one thing differently when launching Horizon and acquiring Baltimore Washington Eye Center, what would that be?
I wish I'd done it sooner.
Wow. That is such a great answer. I love that. Dr. Aggarwal, this has been such an insightful conversation. You've given us a clear, honest look at the challenges and opportunities of making the transition from private equity to private practice. So before we wrap up, what's the best way our listeners can connect with you if they'd like to learn more about Horizon Eye Physicians, Baltimore Washington Eye Center, or simply just continue this conversation with you?
Yeah. My email, anybody is welcome to email me. My email is saggarwal, that's SAGGARWAL @horizoneye.org.
Well, awesome. Thanks a lot for having you on the show, Doc. Really appreciate it. So, as always, people, we'd like to thank Riverside FM and Passionate Media for making this show happen. And of course, Meridian Medical for making it all possible. That's a wrap for this episode of the Q Switch Conversations podcast. I'm Spence, and I am out.
You're listening to The Q Switch with your host, Spence.